Hi, this is Joseph Soto, and this is my career choice speech. In the last speech, I talked about I want to become a RN. So in this speech, I'm going to be going more in depth and talking about why I want to become a RN and what is a RN. So, here we go. In general, a RN is basically someone who provides care and assists physicians in providing treatments to patients in various medical settings. Nurses provide healthcare performances by monitoring, reporting, and recording symptoms or changes of a patient's conditions. Also, they are responsible for maintaining accurate patient reports. So they give out medications to patients, and they're responsible for observing them and seeing if there's any side effects or any reactions. The RN's environment is usually they can work in any healthcare setting. Majority work in hospitals, and they usually rotate shifts, day and night shifts, so they have to take care of 24 hours of patient care. Nurses usually work in close contact with people who may have infectious diseases. So that means they come across harmful drugs, which have strict guidelines to follow. Usually, an RN's salary is between $65,000 to $75,000 a year. But according to Kaylee Maverick in the article "What Does a RN Do?" states that in 2019, the annual wage of a RN is $73,000. So I decided I want to become a RN is because I want to help people who are in need, and I feel like I have great social skills to communicate information to patients properly and communicate to the staff of the facility. And then for my second choice of career, I want to go back to school and become a PA, which is a physician assistant. In general, a physician assistant is someone who provides diagnostic evaluations, surgical assistance, and pharmaceutical prescriptions to patients. However, PA have certain responsibilities demanding on what type of field they go into. And their environment is usually they can work anywhere in the medical field, but usually they work in hospitals, although they work with patients both physically and mentally. Also, they tend to mostly be on their feet and make rounds to evaluate their patients, and they mostly work 40 hours a week, and their salary average is $100,000 a week. And my explanation for becoming a PA is because it's basically the same as me wanting to become a RN, but to further my education and to become more involved in the medical field. And that is basically it. Thank you for watching. This is my career choice speech.